Thank you all for being here for this exciting launch of the updated or refreshed Neami Health Prompt. I first encountered the Health Prompt when I was actually a consumer of Neami services, and it was probably back in 2013 or something like that. But it was the exposure to the Health Prompt and looking at all the other things that kind of get deprioritised or missed or unaddressed that got me involved with Equally Well in the first place. Learning about the life expectancy discrepancy and learning about all these contributors to causes for premature mortality that could potentially be treated, managed, or avoided completely. So it was really thanks to the Neami Health Prompt that changed my attitude in how I want to live my life day to day, but also directed me to something that I'm intensely passionate about and really excited to see all of the positive change that is happening. Not just within Equally Well, obviously, but seeing the opportunity for this partnership to grow and develop, and to see the combination or the collaboration to co-design and improve this refresh. So look, thank you both to Russell and to Tom for being willing to go through the process and bring it all together. Thank you.
You may have noticed in the conference that this conference begins and ends with lived experience. And that's not an accident. And thanks to the committee, we've thought through this very carefully. And that's how it should be. And when we think about in the middle, we have all our partners, we have the governments, and the wonderful things that are happening in Queensland with the smoking cessation across the whole nation, saved as many lives as having zero suicide in Queensland, by the way, over the last 5 years. Magnificent. The work that's happening in New South Wales, big projects, vaccination, free vaccination, a rolled out program, saving lives. The work that's happening in Victoria, embedding the strategy in everything that's happening. And that magnificent work that's happening here in South Australia over so many areas. The new standards, the work around live reporting, the work about embedding Equally Well in teams and having plans and teams and regularly refreshing that, and the other work that we're going to hear about today. Our partnerships with the PHNs, our partnerships with the mental health professionals networks, our partnerships with MHPod, where we do things together to create resources that are freely, universally available. Partnering with researchers, with policy makers, with people with lived experience, those who care and support for them, the providers, practitioners, advocates, anyone with a passion for equality and good health. It's deliberate, and it's a partnership. Why am I saying this now? Our system is fragmented, isn't it? But we don't have to be. We have agency. We're active agents in the system. We don't have to behave that way, and we are better together. The Neami Health Prompt embodies all of this, the development of this. I've got to call out to Chris Jones from the PHN, who contacted me, and it's the organic way as well, said, "Oh, we'd like to use this in PHN land, but how do we get it? We can't seem to access it." So then at a committee meeting with Tom, I go, "Tom, can we do something about this? Can we refresh it and make this available?" He goes, "Yeah, sure, let's do it." And then I'll call out to Maddie and Sarah and Helen and the team, and we basically went and partnered and did this. Co-designed. Bringing the latest, the best researchers around the country, updating it consistent with current research, lived experience, beginning and end, providers, practitioners, service makers, service providers, and policy makers, all together to co-design the refresh in a rather rapid way, I've got to say, but record time. So well done, and real shout out to Maddie and her team. But this also embodies Equally Well, doesn't it, in terms of working together? The wonderful thing about this is now we've got a resource that's freely and universally available, that we'll do it. And this says so much about the collective impact of what we can do and the difference it makes, and the difference it's already making. This is going to really transform and save lives. Scores, hundreds, possibly thousands of lives by rolling this out. So, Tom, it's been absolute pleasure working with your team, and I'll hand over to you that you've got to be really proud of the team, of your Neami team, and it's been an absolute pleasure to partner with you in the production of this resource. So thanks.
So thanks. I guess, when I thought I was coming to the Equally Well conference on day 2 for a presentation at 8:50, I hadn't quite imagined there'd be so many people in the room. So it is really fantastic to see that you're all committed and curious enough to be here to learn about this refresh tool. And I'm sure none of you are here because it's the way to avoid a health screen or because you've been told to by your GP. But I'm sure there are probably some of you who are here probably preferencing Dave or Russell or the Minister over me, so I'll try and keep it brief. Neami has a long history in Adelaide. We're an organisation that started in Melbourne. We're national, as our name suggests. But in Adelaide, we've long provided psychosocial support and homelessness support for communities. We run the Wellness Connect psychosocial program here, the Safe and Secure Housing program, which supports families fleeing domestic and family violence, and the statewide for the Adelaide, also for the Adelaide PHN and the South Australian PHN, the statewide mental health Medicare, so they rebrand it so often I forget the name, Medicare mental health phone lines, and we've got services in Port Pirie and Port Lincoln. We're proud here in Adelaide to work on Gunner land, and I just want to acknowledge that their sovereignty was never ceded on invasion and pay my respects to their elders. I don't need to go into the reasons why we're here. The fact that people who experience mental health challenges have a disproportionate life expectancy than others, they've got poorer health outcomes, and that they're unable or sometimes reluctant to access the screening that they need to enable early intervention. But this tool is designed to change that. As Russell said, it's a fantastic example of the collaboration that happens across the Equally Well Consortia, bringing service providers, researchers, people with lived experience, their carers and kin together to bring what has been an existing tool for Neami. This has been around since 2012, but what it aims to do is equip staff to have supportive conversations with consumers across the social services sector. So it's not a mental health specific tool, but it was developed by Neami and used, as I said, in our services since 2012. Its development and its refinement over the years has primarily been influenced by people with lived experience and their families and carers. I'd like to express my appreciation for the input that they provided us over the years on this, and really, particularly in this latest iteration, how it's been informed by people who bring their lived experience in designated roles within the organisation, because obviously that makes our services so much richer. In its time, it's been championed by many people in Neami, and I want to particularly call out Vicky Langan and the team that sat around health promotion in Neami when I first came 6 years ago, because they really pushed this tool hard across our services and worked to make sure that it was evidence-informed. And more recently, as Russell shouted out, to Maddie Prince, who's our national practice lead, and her team, and the comms team, the engagement team, everyone for putting in an enormous effort to doing the work on refreshing this tool, which has, as you said, Russell, happened in record time. And we were really excited to be approached by Equally Well to do this because we know it's valuable. We know we've also adapted this tool ourselves. So there's a specific Indigenous health prompt and a version for older people and for young people as well. And we look forward to working on a refresh on those particular tools as well to make them publicly available. At Neami, we know that context and connection matter when we work with people with mental health challenges. And what this tool tries to do is not be a tick box approach, but it tries to provide a framework for strength-based conversations with people about their health, to explore their confidence. So it's not just what's your health problems, it also seeks to look at and understand what people's confidence is in seeking care and their experience in healthcare services previously, to build and enable them to move forward to get the screening or healthcare that they need. Staff can use particular elements of it. You don't have to use the whole tool at once, and it's designed so that over time it can be used every 6 months. The most recent refresh, as we said, has been a real team effort across all organisations. We know this tool works for staff and for service users. It's about connecting consumers to the right healthcare, the right screening, so we address the issues that Equally Well was set up to address. There's no point in having a tool like this if it just sits in Neami services or in the laptops and G drives of our organisation, which is why we want to share it across all social services. So you've all got copies that staff have handed out. At Neami, we really value learning and we really value connection. So there is this is really dangerous when I get the clicker, but I could have gone to that one earlier, couldn't I? We know it works. We've had the feedback from staff, we've had the feedback from the people who we walk alongside that this is a really effective tool. You can access it there. If your fine motor skills and eyesight are good enough that you can get your camera on that, that's really great. If you can't, maybe think about going and having a vision screen and testing your eyesight. But we want this to be available. We'll be pushing it out to all primary health networks across the country in the coming week. We want this to be available for everyone because it's pointless if it just sits within Neami services in a Neami context. As I said, we know it works. It's been a fantastic collaboration between all of us, and I really hope that you're able to go back, use this tool, distribute it widely, sit with consumers to have meaningful conversations to enable them to remove the need for this organisation. Thank you.